Hello, hello, hello. This is Truth Be Told. This is Dr. Walter Aka.
Dr. Kyle Dumpert.
And Dr. Gary Dennis.
Dr. Dennis, what's going on?
Sukirti.
Suki, go ahead. I'm sorry.
Sukirti Misra.
Okay, Suki is our guest for today. She was previously a dentist in India, so we brought her on to just basically give us the knowledge of how dentistry is in other countries. So Suki, go ahead and just give us a little background about yourself.
All right. So I had my humble beginning in India. So in India, it's pretty straightforward. When you're in high school, if you are good in math, you become an engineer. If you're good in biology, you become a doctor. And that's how I ended up being a dentist. I did not want to be a doctor. I thought the hours were very bad and I didn't want all that. Anyway, so I chose dentistry at the time. I had no prior experience. I don't think I even went to the dentist before that because there is no emphasis on preventive dentistry in India. So after high school, I got into dental school. There was no bachelor's, nothing before that. And then once in school, you get to know how it works and everything like that. And honestly, dental school was really scary. I didn't expect a lot of the things that I faced there. The teachers were really hard on us every day from day one. And it was a tough 5 years, basically. I don't know how it is in the US. I never went to dental school here, but that's how I started. And then honestly, immediately after I finished my internship, so you have to do a 1-year internship in India to get your license. You don't give any national board exam or anything. Once you're done with school, you do your internship and you get your license. And the moment I got my license, I was already engaged to this guy in the United States, and I moved here. And that's how it all started, basically. And then, so I didn't get a lot of chance to practice in India, except for that 1-year internship. But that was like right in my school, which was also a hospital. And we saw patients for free. And we did, so I did get a rotation of all, ortho, perio, endo, everything. I got to be in each department for about a month and a half. And then we would just move on to the next one. So that was my internship.
Okay.
And then I got here.
Okay. Well, Dr. Dennis, go ahead and ask the first question. I promise you can get your first question.
Thank you so much.
You're welcome.
I guess my question is just, why, once you got here, did you choose to go into hygiene as opposed to pursuing being a dentist in the United States?
That's a really good question. No, I actually pursued dental schools. I did apply in one cycle. I didn't really know a lot of people here. Obviously, I had just moved here. My friends were my husband's friends, and he's an engineer. So I really didn't have any friends or anyone to really guide me on what to do. So I got here, I did not understand the system at the time, I feel like. All I knew was I had to give my NBDE pass and then just start applying to the university. So I did do it one cycle, and I was really discouraged that I didn't get in. But I didn't realize that I needed a whole bunch of other things to add on, like make a great resume, make a great SOP, have some experience here. And then these things I slowly learned on my own. Mm-hmm. And I understood, and I basically, honestly, since then, I like the way things are done in the United States. Like, I like it how you start from the bottom. So you get in a dental office, see how the system works. And then, you build your way up. I really like the way that things are done here. So I did start from the bottom. I was in Austin at the time, and there was a really great dentist. She really helped me. She let me stay with her as a volunteer in the beginning because of visa statuses. I couldn't work. So she let me just volunteer in her office for a little bit. I would observe, clean rooms, and do, those little things. And then once I got my working visa, she let me work in the front desk. So I did a little bit of, scheduling and financials, and then I did a little bit of assisting. And I thought assisting was really hard work. And I was like, I can't do this.
It is.
It is a lot of hard work.
It's a lot of hard work.
Dr. Dennis got his start that way.
Yeah, that's not a fun job.
Yes.
Well, can I ask a question? Can I ask you a question? Let's
Yes.
go back to when you were in India. The one thing that you said was you didn't know much about dentistry, but then you went into dentistry, and you almost made it seem like your path was already kind of like preordained, like somebody just made it up for you as you went along. While here in the U.S., people are like, "Oh, I love teeth," and whenever you interview students, they're like, "Oh, I love teeth. That's why I went into dentistry," and so forth. But for you, it doesn't seem like that. It almost seems like you were just kind of like, this is your path because of your skills in biology, your skills in math, or whatever.
Mhm. That's true, Doc. That's what I'm saying. That's a big cultural thing. But that's how it is. And parents are really involved in our lives. And their thinking is that they want a better future for us than what they had. So they are basically looking at big careers, doctors, engineers, where you can go ahead and have a bright future versus like my dad was a teacher in a government school. He earned decent, but he didn't really get to be like a rich person or whatever. So I was brought up in a lower middle class family in India, and my dad had big dreams for us and my mom. So yeah, but that's the way it is. They kind of really push you towards choosing engineering or being a doctor, so you're not stuck being in a low paying job basically.
Okay.
Now we complain a lot about certain aspects of dental education, specifically the cost of going to dental school. Do you mind sharing what that looks like in India? Because here, the traditional path is 4 years of undergrad, 4 years of dental school, and then either if you want to go out and practice or do a residency or specialize after that. So we're at least 8 years in as far as paying for education. And we're up over 300,000 as the average coming out of school right now. So what does that look like in India?
Okay, so in India things are done totally differently. So after high school, we give an exam, which is like an all India exam. If you get in that, the fees is very, very minimum. You get into like government schools, and I would want to say if I want to convert it to US dollars, I would say like $100 a year.
Oh, wow.
I'm going to spend my kids.
No, you don't want to do that. We can have a podcast on that, on why not to do that.
$100.
And then the other thing is, then if you don't get in that all India, because remember there are a lot of people in India, so it's a very stiff competition.
It's a little bit.
It's a lot of us. So if you don't get in there, which happened to me, then you start applying to individual states. And the state will accept a few students like out of state, but their fees is higher. So I did get into a different state. So you give the exam for the state specifically, and then if you get a good rank or not, then you apply, and then you get a seat there. So my fees was a little higher since I was out of state. I would want to say in US dollars for my dad, it was about $1,000 a year, which is a lot of money for him. But he, like I said, he arranged all that. And then and that's 4 years of school, because internship is basically, like I said, it's just working. So you don't pay anything, but you don't get paid either. So,
okay.
Yeah.
Is it that $1,000 a year? Are you paying that out of pocket? Is there a government financial aid system for loans, or is it family taking care of you?
No, there's no financial aid or anything. No, that was all out of pocket for my dad. And he had to arrange money by sometimes selling, stuff and things like that. I won't make this depressing, but he did whatever. Yeah.
No, I mean, to me, that shows the motivation that your parents had for you to do better than them, right? Based on what you just said. So everything it takes for you to excel is what they were going to do.
Absolutely.
So I mean, it's not depressing. I think it shows, sometimes we're spoiled because we can go to dental school, we get in, and we can literally write on a piece of paper, I want to take out $100,000 like it's nothing. Literally, it's just a piece of paper. There's no one saying that they had to sell their house or anything to get here. It's okay, write this, sign on this piece of paper, and you got $100,000 loan or whatever it may be. 300 this house at $300,000 is the average that people are coming out with. So I think that speaks a lot, and I think people need to understand and appreciate some of the systems that we have that kind of allows people to go through what we complain about.
Absolutely.
So you said that the first step is you take an exam that everybody takes, and then you get in, and then the states will also allow you to come in on that point. But okay, so past that, right? How is it in school? Like, what are some of the classes that you take? How intense is it? Because you've gotten in. It's basically government education. So is it like, okay, I need this, I want to specialize, so I'm going to be the top of the class? Is it like that, or is it just everybody just wants to get and graduate?
So dental school is very intense. And another cultural thing is that the teachers in India, they will act like your worst enemies. They are not your friends.
That's how it is.
You can. Oh, okay. I didn't expect that. I'm not like that in hygiene school.
Right. There you go. You're nice.
So, but they are totally unapproachable. They are treated like gods. So basically, we've been taught since beginning that teachers are our gods because they give us a better life by educating you and making you better, whatnot. It's like a brainwash. Honestly, I didn't feel it until I got out of India. That is really a little intense because some of these teachers were not really nice people. But, and they would like insult you in front of others. Like if I had long nails, they would insult you in front of others and things like that. Anyway, so there's no help from teachers, basically. Your friends, your classmates, if they have your back, you basically get through school somehow because you have to look for your own patients. It's the same thing. So first year was, basic anatomy, physiology and all that. Second year was pathology and things like that. Third year is when we really started clinics, and of course the fourth year. So it was, and then fourth year was where we went in each department. We would be assigned to like orthodontics for a month and a half, and then you would just stay there and do your retainers and whatnot. Not going into detail because in India, honestly, everybody is doing their masters. Because like I said, we are just too many there and everybody's got a bachelor's now. So they go and do their masters to be an orthodontist or endodontist and things like that.
Sounds like Howard.
How many specialties are there in India? Because we have we have what, 12, 14 here?
Yeah. Public health, and now anesthesiology is added on. So yeah,
and oral medicine.
It's the same, dog. They follow the same system. They usually take stuff from either UK or United States. So it's usually the same.
And is it the same time requirement wise for those specialties? For perio, it was what, 3 years?
3 years.
And what was endo for you? 2 or 3 years here, Gary?
Yeah, depending on the school. If it's 3 years, you're definitely going to get your master's. 2-year programs, some have masters, some don't. Some have an option, stuff like that. So 2 to 3 years.
Okay, so that's all pretty much the same in India also.
It's always 3 years of masters.
Okay.
No matter what you choose.
Oh, okay.
Yeah.
I like to think dental school is probably one of the hardest professional schools to get into. I think they were telling us whenever I was in school that dentistry was probably the most competitive. I think Pitt might have had 4,000 or 5,000 applications for about 180 to 100 people getting in. What did the competition look like getting into a school in India? Do you know how many seats were available versus how many people were applying?
So in India, getting into medical school would be much more harder. I don't really know the percentages of, but it was a lot of us and very little schools. But basically, medical school is much harder to get into. At the time, dental was, like I said, in India, since there's no preventive dentistry and whatnot, dental school was kind of like upcoming, honestly, even in like 2000s, like because not a lot of people, like there's no awareness of uh, getting your 6 months cleaning, even x-rays. They don't do x-rays until something hurts. They don't do any routine x-rays. That's unheard of. They will do, and the other thing is they're very conservative. So whatever they can save, they will not try to, like wisdom teeth, they would do a root canal on a wisdom tooth versus taking it out. It's like, no, it's like whatever God gave you with this, you want to keep
I do that all the
it or
time.
something like that. I'm sure.
But you know what? But you know what though? I actually like that a little bit better. I'll be honest. I like that the idea of let's keep what you have. You know, I mean that's why I went to perio, because I'm like, let's keep what you have. Let's do everything we can to keep what you have. But do you guys believe that that trend is going away? And do you also think that in India that's also going to happen, where people are going to start doing what we do in the U.S., which is let's take out wisdom teeth as soon as possible. Let's take a teeth out and place implants. Do you think that's going to transition that way?
It's if they're thinking about it, Doc, it will be really hard, because I'm sure even here you must have seen Indian people are very hesitant to do that. If you tell them that, hey, you must have seen that, I'm sure, where they're like, oh, this wisdom tooth is gonna bother you at some point, but they're like,
Right.
oh, it doesn't bother me now. I'm not
That's
getting
right.
rid of it.
I see that.
That's just the way it is in India. They will not, because that's like kind of embedded in us. I had to get out of that too, and I feel like some part of it is still left in me. But I got my wisdom teeth out 3 years ago, and I'm very happy. But I had to fight with my mom, because she was like, "Why are you doing it when it does not bother you?" And I'm like, "Mom,
I kind of like
I know a little bit about dentistry, maybe."
Because I'm
so,
the dentist, Mom. You sent me to dental school to learn about this stuff, Mom.
I mean, let's be honest. My mom's still a so
Yeah.
it doesn't matter what you are to your mom. Who cares? Yeah. Okay. Wow. Okay. So let's transition into, now you're in the U.S. and you're a hygienist, right? And you're teaching in hygiene school now. So tell me, like, what you're seeing when it comes to teaching American students versus India. You remember, you're a teacher, you're God, you're awesome, you're the best thing that could ever happen, right? And then in the U.S., people don't have the same respect for teachers. So what are you seeing when it comes to teaching hygiene, and where do you see when it comes to the future of hygiene and how it looks?
Okay, now I'll go back a little bit. So hygiene, honestly, even back in India, when I had my perio postings, we called it postings when we were in the, when we were in the department and whatever. I loved perio. I loved to see that effect of at the time only just cleaning teeth, because we didn't really go under the under the gums. So I would get to take out the super gingival, and I would be so happy, like the whole change.
Me too.
And, and then so it kind of attracted me, perio in particular, and hygiene, because it was all about preventive, and that's something, like I keep saying, in India, it's so missing, I guess. I wanted to be on the other side where I could talk about a lot, like preventive, just do things before it gets worse, kind of a thing. I take that very personally. Honestly, sometimes when I see a 16, 17-year-old patient losing their first molars, I honestly start, like, I get teary-eyed, because it just breaks my heart. Like, if they had done something, or, we could have saved that tooth that was supposed to last a lifetime and things like that. So I sometimes take it too personally. But that's what I loved about hygiene. I realized when I came to India that that's my passion, that honestly, more than clinical dentistry, I really liked hygiene more. And then I chose to go into, hygiene and everything. And then I did a little bit of teaching dental assistance. That was at Thema Medical Institute. And I loved it, because I felt like the students responded really good to me, even with a weird accent and whatnot. They understood me. I didn't think they would, but they did. And I felt like like that passion of preventive and just dentistry in general came through to them, because they really took a liking to me, and I loved what I did. And so I wanted to do hygiene instruction and whatever. And then the teachers at Lamar, that's where I teach, Lamar Institute of Technology in Beaumont, they loved me there. They said I brought in something good for the students. They understood me really good, and I brought in uh, things from India to make them laugh and wake them up or whatever, also surprise or shock them, because I have some really interesting stories from India of what we did. So, uh, and yeah, just talking about preventive is really awesome to me. I don't know if I answered your question. I don't know. I think I went
Well,
on a
well,
tangent.
no, no,
No,
no.
that's a good answer.
So for me, I want to know, like, what do you see when it comes to the future of hygiene, right? Because a lot of I'm noticing, talking to a lot of hygienists, and after about 5 years, we'll say they get burnt out and they feel like they're overwhelmed and they feel like they don't want to do hygiene anymore. They even have groups on Facebook that talks about what do you want to do outside of hygiene. And so I'm asking you, what do you see when it comes to the future of hygiene, and how do you help them to kind of keep that passion going for a longer time?
So I feel like there are two aspects to that, because clinical hygiene is a little intense, Doc, I've heard about, carpal tunnel and back pains and everything else. So I don't know if it is about that. I don't think you would lose the passion for hygiene. Even the people who get out probably don't. But I do worry about the physical, pain. And if I'm not able to do it, what am I going to do? And honestly, that's something that drove me to what else I could do if I'm not able to sustain this clinical, working clinical hygiene. And that is why I try to do teaching. I did get my master's also, in case if I have to do that more. Teaching and stuff like that, but I feel like hygiene is not going anywhere. If anything, the future is almost brighter than before, because I feel like people are getting more aware. Yeah, and it's so awesome to be in the United States, because there's so much diversity, and I see Indian people here, and I try to educate them, and I feel like sometimes they respond to me a little better because they build a trust with me. So we're trying to change that, and trying to prevent, and I don't feel like it's gonna go away. It's here to stay.
I mean, I can sense your passion, so that's awesome.
Yeah.
I do have a question about the one thing I remember from dental school that is oral pathology, but they talked a lot about beetle nut and how devastating it can be as far as cancer. We obviously don't have that here in the United States. Did you see a lot of that or learn a lot about that in dental school in India?
What was that, Doc? I didn't understand.
Beetle nut. It's a some kind of leaf. It's kind of like tobacco, except
beetle nut. Oh, beetle nut. I got it. Okay. Oh my God. Yeah. Beetle nut is very, very common in India. And did you say the cancer is associated with it?
Yeah. Can you explain to everybody what beetle nut is, what people do with it, and just kind of give us an overview?
It's so bad, Doc. I don't know. It's some kind of really like cheap stuff that they get, and they chew on it like a dip. So they basically keep it on their vestibule for hours, and like all kind of like smokeless tobacco is very common in India, very, very common. To the point where people spit on the streets and on the buildings and whatnot. So they try, that's part of the clean India a plan, that quit tobacco so we can have clean places, because people just spit. Anyways, but yeah, oral cancers are very, very common. A lot of people don't realize it until it's too late. I have personally had one of my relatives had a squamous cell carcinoma on her tongue, did not know about it, chewed smokeless tobacco all her life. She put it there on that vestibule. That's the side that she got it. She just happened to tell a doctor when she was there, like, hey, this said that just been there. Doesn't bother me, so I'm not concerned, but could you look at it? And it turned out to be like stage 4. And they had to literally, it's bad. But it's very, very common. I don't know, probably people die on it. There's, like I said, so many of us. I don't think there's even data on it really, and data collection in India, I don't think is they can keep up with the amount of people that use tobacco. Even now, a lot of my cousins use it, and they just start off early, like in their teens or sometimes even preteens, and just won't quit.
Well, let me ask a question actually. So this is just for me. So I watch Bollywood movies. I enjoy them. And I feel like they glorify a lot of the cool characters, like the smoking and all that stuff, right? How do you combat that when you're in India and you're a dentist and you're trying to explain to people that smoking and chewing tobacco and stuff is not as glorious as it is on a Bollywood movie, or how do you do that? How do you kind of fight that prestige or that image?
I know I think they're making some efforts to where they're adding some warning signs now. I think the new government is trying to do that.
Okay.
But it is true. And like I said, it's very common in the youth. And I remember when I was in dental school, I would love to sit with them and talk. And I would, in India, sometimes as a doctor, you can also have some authoritarian, like you can, in a way, scare the patients or, be a boss of them. I don't know how to say it.
Scare is good.
But I was like that. I would just try to. But I would show them pictures. I try to do my best. But honestly, I feel like, again, it's something that's ingrained in them. And I don't know if it's, if anything can be done like, hopefully something will be done eventually. But right now, I feel like, it's just, they just glorify it. And a lot of Indians look up to America like, oh, that's what, we want to grow up to be and all that. But in a bad way, like not the good things, just the bad things. Like, so anyways, yeah, I'm gonna.
All right. Well, let's I think I feel I definitely feel your passion when it comes to what you do. I really feel that. Man, I'm just trying to figure out how can we transfer that and kind of get the appreciation for what we have in the US, because I don't know if we have that appreciation, and it's kind of bad because this podcast, we do a lot of complaining. Let's be honest, guys, we do, right? We always find the negative. So let's end on a positive like we used to. Let's find something that will kind of motivate us to say that, hey, we have it pretty good, because you said that in India, being an MD, a doctor, is really prestigious, not so much being a dentist, right? But in the US, do you guys think that in the US is the same kind of mentality, or do you think dentistry has become a little bit more prestige to people?
It depends who you ask. If you ask a physician, what do you think about dentistry? They're gonna be like, they're not a real doctor. And so they're sitting in the chair and they're like, my face hurts. And
right.
Like, oh, I'm not a real doctor.
Okay. So how do we take what you learned in India and transfer it to what, how do you transition? Because we deal with a lot of, some Indian patients. How do we get them to kind of change their mindset? And I guess we'll end it here, but how do you get them to change their mindset from what they are culturally ingrained to understand and know?
Okay, so for that, one thing that I have felt is building trust. That is a big deal for Indian people. They're very skeptical about healthcare in general. In India, you might go for a cough, they will knock you out and take out a kidney. That's very common in India. So they have a lot of mistrust in healthcare in general. So honestly, that is the reason why they are so hesitant to do whatever we recommend and whatever we suggest, because there is that matter of trust. So I feel like we need to, but especially with Indian people, as providers, you'll have to build some trust with them. They need to feel that you care about them, that you're not recommending just, ABCD, a lot of treatment that may or may not be needed. They need to feel that, you are not doing it just to build the insurance, like money wise, you're not just doing it for the money. So they need to basically like you as a doctor, as a person. to basically give that trust in you that, okay, you doc, if you're saying this, I will do it. And I'm telling you, honestly, they will get there, because I went through that whole journey, seriously, because I was the same. But once they get to have that liking for you, honestly, they will not see another. They'll be like, nope, if Dr. Aka's not there, bye-bye. I only want to see him. And they will do everything you would say. If you say, okay, I need to chop your head off, they will do it. No, I'm kidding.
But that's actually so different from.
I went too far.
No, okay. No. I understand. I mean, but guys, don't you think it's a bit different from like some of the American mentality? Like the American mentality is almost like, okay, yeah, just do whatever you can to charge my insurance. But even it sounds like what you're saying is even with the Indian population, it doesn't matter if they have insurance or don't have insurance. It's, do I trust what you're saying to me?
Yes.
And are you going to rip off my insurance, or are you going to rip me off? It doesn't really matter. It's all kind of tied together.
Yes, Doc.
I don't think it's any different for me.
So you think American mentality is the same as their cultural mentality?
Yes.
Well, break it down. You don't just say yes. You break it down.
All right. I mean, for me, because every patient I see usually once.
Okay.
In their entire life, usually. Okay. Right. So that means I have 15 minutes to let them allow me to put a needle in their face after first meeting me.
Right.
So I have 15 minutes to gain their trust. So, and a lot of patients come in and I'm like, what brings you in? They're like, I don't know. My dentist told me to come here. And I'm like, they didn't tell you anything else? They're like, no. And so they don't even know why they're there. So I have to gain their trust, explain everything to them, let them know that I'm not trying to steal their money and all that. So I feel like it's pretty much the same that I have to go through with patients that I see.
Kyle?
I think it depends on the patient. I mean, I have the emergency patients are definitely easier to convince to have something done because they're in pain. Whereas there are people that, no matter what you tell them, no matter what you show them, they're not going to believe what you're doing, or they think they know more than the dentist does. So I don't think it's a one size fits all, but and it also depends on what population in the United States you're working on. If you're in a more low income, there might not be as much emphasis put on investing in your oral health. It's more of just take it out. It doesn't matter. We'll just take it out. I'll get dentures. My parents had dentures at 18. I'm going to have dentures. So it's America is such a diverse population that it's hard to make a blanket statement about. And I'm sure India is the same too. But it's different socioeconomic areas are going to respond in different ways.
Right, but I do believe that I think what it comes down to is trust, right? So I don't care if you have a lot of money or no money. I mean, you still have to kind of earn the trust of the patient. And I think that's what I'm getting at.
Okay.
Right?
Yeah.
Okay. All right. Well, thank you so much for coming on and educating us a little bit about, just the difference and similarities of India versus the U.S. when it comes to schooling and stuff, and that we should be a little more appreciative of what we have. I'm not sure about the, $300,000. I'm never going to be happy. I do appreciate, and you've shed some light on some of the things that we need to look out for. So thank you so much for coming on. We definitely appreciate you. I've gotten the pleasure, I should say, of working with you, and I really think your personality is very infectious. So I really do appreciate.
Oh, thank you, Doc. I wanted to say that it was an honor. The first day you told me that you wanted me, I was so happy. I told my best friend, and then I didn't hear from you, and I thought I jinxed it, and I was so sad. It's been a real.
he does that.
I was like, I should have said it. It didn't happen. And I listened to the podcast, and I love it.
Yes.
And I've learned so much. And I was a guest lecturer for like a lecture at another class in Lamar. And I used some of the material from the podcast. And I thought that the students could understand it more because I feel like you guys, even, I don't know if you realize it, but you simplify some of the concepts for for easy explanation, and I love it.
That's
So,
good to hear.
and Dr. Dennis is so sweet.
Oh, well, thank you so much. I'm sure not too many people would agree with you.
I can tell you, the first time you've heard that from anybody. That is amazing. I'm telling you guys, she's like our third, fan. So this is awesome.
Thank
And
you
I've
so
told a
much
lot
for
of
all the
people about the
positivity.
podcast. So I'm
Oh,
sure you'll
awesome.
have more subscribers, hopefully
Aw.
from Lamar. Yes.
This is awesome.
Yay.
That's
I don't
awesome.
know how to end this. This is the best way.
Yeah,
Thank you.
I appreciate all of the positivity you have. So thank you very much for that and coming on.
Yeah. Thank you so much.
Well, thank you so much, and
Okay,
we'll
this was
talk soon.
great.
Okay. All right. Bye, guys.
All right, enjoy
All
your
right.
Sunday.
Perfect. Bye.
All right. Take care.